In the United States today, we're in a time of change. We have our health care moving into systems of accountable care. The idea is that we would have a more cost-effective, responsible set of providers taking care of all of us in a way that had a higher quality and a lower cost profile. The leading edge of that trend are in Medicaid, the HMO industry, which is currently enrolling adults and children in the states at a substantial rate. Currently, we have 70% of all the Medicaid enrollees in the United States in a form of managed care plan. Now, our medically complex children historically have not been in these plans. When you look at medically complex kids, they are regional kids for the most part, meaning they travel across state lines. They will often see multiple providers.
There have been a lot of challenges with Medicaid, especially crossing borders, state borders, to receive specialty care outside of New Jersey, where we live now, going into Philadelphia. It can be very challenging to access that care.
The medically complex children particularly constitute a very high percentage of Medicaid spending. They are frequent users of our healthcare system, frequently in our children's hospitals, in our pediatricians' offices, and it's a population where we can benefit them by offering a more managed, organized network of care.
By having Medicaid, Lily was able to get all the surgeries and the care that she needed and still needs, and it ultimately saved her life. Medicaid is not just a poor person's insurance. It is put in place for medically fragile children that need health insurance in order to improve their quality of life.
The children that we are proposing to take care of are about 2 million in number. They constitute only 6% of all the kids enrolled in Medicaid, but 40% of the funds that we spend on children in Medicaid. A specific proposal is that we have medically complex kids taken care of in medical home networks. These are national in nature, and they allow these kids to be taken care of uniformly across the United States, independent of which state they live in, as many do travel from one state to the other. These networks also give us the basis for national information, national quality standards, and an ability to improve the care of these children overall. As far as network economics go, we've got an opportunity to save money in the 10 to 15 billion range over 10 years, which is a significant contributor to the Medicaid budget problems that we have today in Washington and at the state levels. Our children's hospitals would anchor these networks along with the pediatricians in the community, the pediatric subspecialists, and a host of other providers and social services that are necessary to take care of these kids. Our feeling is that it's important that these be nationally designated and nationally legislated so that we have a consistency in this program, whether you're from the West Coast or the East or from a rural or a big city area.
Medicaid for kids with medically complex conditions is important to ensure access to care, to ensure strong coordination of care, and that the Children's Hospital as an industry want to work with the federal government to be fiscally responsible in how we pay for that care.
The proposal is a benefit for families and children, and it is a benefit for the public and our payers, and it is a win-win for both. It's something we should be actively looking to legislate and to put into public policy as a major part of how we care for children in the United States.